Okay. I call this meeting to order. It is 5:34. Mary, do we have a quorum? We do have a quorum. Okay. And Ted, would you be willing to say the budget?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Father, I thank you for this day, and I thank you for the moisture you've sent us, and I thank you for this hospital. Just pray that we would make wise decisions and that we would be looking out after the interests of the community. Thank you for that. It's in your name we pray. Amen. Okay. Do we have any visitor comments? Sir, hi, Emily.
None.
Okay, so if there's no visitor comments, I would take a motion. If you have any changes or anything we need to do as far as the minutes?
Which minutes we're looking at?
We got like 4 of them, I think. June 19th is the first one. And June 26th.
Yep. And
then July 7th and July 10th.
Well, we've been spending our time.
Yeah.
That was one of the,
July
10th we don't have, right?
Yeah,
they're done. So we'll have July 10th. Okay, so
Yeah. Everything was in there.
No,
I just put it in today. Oh, I printed this morning.
Then we'll probably have to have that pulled up for the July 10th.
okay.
Have you read them?
Oh,
I've got them right here. That's fine. I can read them from you. It's okay. I can read them from you.
you took those.
Oh,
Read what she has.
Oh, correct. Those good things, you guys want to look at it? Yeah. I've seen
You've seen the July 10th.
Okay.
Okay.
Oh, this July 10th.
Yeah, that was the only one I didn't print this morning.
It looks good.
Let's go with the vote.
Yeah, that's what you for, I'm not good. Well, that seems like dangerous.
Actually, yeah. We see it the afternoon. Right now. You want me to do that in changes or? Well, this time.
Well, probably wait until after we approve. Okay, so we need to, like, let's skip number 5 real quick, just go addition and changes, because we have 5 and 7 should be right together. I don't quite, I do that.
What you're gonna do? Island.
Okay.
Oral.
So if someone would like to, I'm just gonna cross out number 5. Okay, and then we're gonna ask, is there any additions or changes to the agenda?
Madam Chair, number 7, can we just change the heading to approval of the minutes?
Yes.
Well, you need to vote on that?
Yeah.
Yep.
Can we change 7 to approval of the minutes and then make 7B?
Yeah, there you go.
7B, approval of the agenda.
Okay, yeah.
7.5? Make 7.5?
That works. Okay, so can I have a motion? You moved, we need a second.
That motion?
Yes.
I'll second it.
Okay. Any discussion, any more discussion? So 7.5 will be approval of the agenda, right? Okay, so all those in favor of changing the agenda to 3 minutes on number 7? Say aye. Aye. All those opposed, same. Okay. Okay, so got that done. Now I need to approve the minutes.
Madam Chair, I move that we approve the minutes. So I go backwards, July 10th, July 7th, June 26th, and June 9th.
Okay. We have a second.
Second.
Any discussion? All those in favor of approving minutes, say aye. Aye. All those opposed, same. Okay, the minutes been approved. Okay, so everybody had a chance to look at the agenda? Do we have any additions or changes or anything? Can we just, I guess, we need to just approve the agenda.
Madam Chair, I move that we approve the agenda.
I second it.
Okay, all those in favor say aye.
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 All those opposed, same. Okay, that being said, Kim, you're up.
So for my quality report piece, I'm still trying to get used to giving you guys a quality report, not just reading over my minutes. So, we are going to try to do our quality committee. We are still gonna meet monthly. I'm still gonna meet monthly, but we are gonna have the different departments try to come quarterly. That way you guys will get different information every time, just not the same old information. It'll be different, mix it up for you a little bit. So we'll see how that goes. We'll give it a try, see how people like it, and if it doesn't work out well, we'll just kind of go back to what we were doing. But I think it'll go fine, and the managers won't have to sit another meeting per month, so it'll be nice for them, hopefully. I just kind of wanted to touch on the CNA situation. I've got 15 enrolled in the hybrid program. In the last month, we applied for 6 licenses. Unfortunately, 3 of those failed recently. Their skills test, so their temporary licenses were pulled, so they just have to retest. They don't have to retake the whole class or anything. They just have to pay and retest. And then I've got 3 that were licensed. They're just waiting to test. So hopefully here we'll get 6 CNAs coming out. Over on the Manor side, we did do a root cause analysis. We had some med cart keys go missing. And so we did the root cause analysis, figured out what had happened, just error happened. So we've got new med room lock on there. We actually had new med carts on order, so that was actually a happy coincidence. So we didn't have to replace med cart locks. We've got some new processes in place. Nurses are happy to sign for keys now during shift saying that they're responsible for their employees. Am I missing anything? You touched
Policy.
no change in policy. So now keys go missing and we can't find them at all. It's subject to like the drug diversion policy. They make you do that drug screen before you leave for your shift. So that's about that on that. I did do CMS reporting today, so that should be reported out for Q1 of this year. Once that gets posted, I'll put that in your guys' SharePoint so you can take a look. The majority of that is our transfer times, how we're doing and how we measure up to the rest of Wyoming and how we measure up to the nation as well. They did change how I do my reporting, so hopefully the numbers will be more accurate. There were some times where the numbers weren't pulling over like I did stuff, so now I directly enter that information into the HQR, which is a policy. But hopefully that gets better as well, so I'll share those briefly to get those. That's a little bit for me. Yeah, thank you.
Do you have any more else more on that, Mary?
I don't think so. I think you covered everything. I like the idea of changing the department heads have to come just quarterly. It'll free their time up and shorten the meetings. That's all great. Yeah. That's the theory for normal. Well, I think it's a good idea. Good.
Okay, she.
Yeah, current census is 53, so we averaged 51 in June. Yeah, June. Had 1 admission and 2 discharges in June. I currently have 2 referrals, with one of them hoping they're going to admit 1st of August. So, overall star ranking hasn't changed. We're still 3. Is still our biggest thing we're working on, so. Have 9 agency staff members, 1 nurse, 8 CNAs, but we do have a LPN starting either end of this month or beginning of next month, and we have an RN interview in August. So we did just start a CNA last week and another one hopefully into this month. So yeah, just kind of waiting for everybody to pass their test and get done with class. So if they're there, it's just patiently waiting for them and trying to get through all that. And then our Medicaid pending, it's actually dropped. We're down to 5, and out of those 5, 2 of them, everything's in. We're just waiting on the state to approve it. So
That is progress. I was just noticing, just so you get the feedback to the staff, they should probably send a letter out letting families know the podiatrist is seeing their loved one, because I've had a question about that, and I just assumed we would have called them or told them about it. So, yeah. Thank you.
Yep.
I had received a letter from Fall River or something or other.
Dr. Potter.
And I wasn't familiar with the name, and I thought, okay, what kind of scammer we were at? Is somebody, it was a questionnaire. It really didn't ask for any personal information, but I thought, okay, I don't know that she's seen anybody like that, so what kind of scam am I? If I get asking about this Fall River outfit, who in the heck are they? Are they using somebody else's social security number, name, or that kind of?
You do have to be careful about that stuff anymore.
Yes.
The questionnaire was not asking for that personal information, but a lot of these scams set themselves up a little bit.
Yep.
Well, the good news is she's doing a great job. She has really, she's making sure she has patients that are diabetic or certain conditions that have a high risk, that she's taking care of their feet.
Comes in every 6 weeks rotation with all the residents who are seen. So yeah,
Better care for them. She's a very pleasant person too, which is always nice if you have the combination.
Okay.
Okay, so on to Finance Committee. You're up first, Carrie. It looks like, so there's 2 have any extra papers I left. I did not put mine out. I will go grab.
Oh, no, because Shane and he doesn't mind my scribbles.
Okay. Thank you, Jane.
So we are still working on getting, good, solid financial reports. Tish and her team are doing a great job, of making progress. So one of the things we discussed and are working on is getting accurate numbers for revenue, broken out by the hospital, the nursing home, the clinics, because they all use somewhat different systems. So Tish is making sure all of those numbers come over properly into the accounting system, and we discuss ways to reconcile and to get accurate numbers from the different departments and get them to funnel onto the financial reports. So please know that these are still a work in progress, but we did set a goal of next month. The finance team will have will have department level reports out to the finance committee. We won't roll them out to the full board yet because we're going to play with different formats, and Tish is going to give us an idea of what she can give us, and then we're going to talk in finance committee about the best way to get them out to the board. We want to make sure that you have enough detail, but not too much detail that it's overwhelming. So, yeah, we're going to discuss different ways to make it accurate, usable, and concise.
Well, that's a goal. Accurate, usable, and concise.
Yeah. Maybe not next month, but soon after. Tish is going to have some data for us to work with next month, so we're really excited about that and looking at the different formats. Tish also has a accounts receivable project. It's in the works. As you remember, the board approved the consultant, and the consultant has started and is in the middle of the process, and I'll let Tish describe that whole thing to you. But that's what we're working on in finance committee. So.
Lots happening in finance committee. So the consulting group that we hired, Nova Revenue Group, they have completed all their staff interviews, and so they are working on processes. They watch them work. The week before they did the staff reviews, they actually went into Epic to make sure that where's the software, how is it working, what are we missing. They found out our back end scrubber for our claims was not activated, and whether we don't know how it happened, we put in a ticket. So what that does is that when the claims come through and they're read electronically, it compares it to the contract to see if we were paid correctly on the claim. It's a great tool, and we want to make sure that staff can use it when they're working on their denials and things like that. And so what it's supposed to do is drop all those claims into a work bucket. That piece is missing, so the billers don't have any idea whether their claims are getting paid correctly or not without going in and doing the research. So it's a cumbersome process. This should make it much faster to go in. And then also verify that we're getting paid what we agreed to. So that was a big find. That's a big find for me. So everything else is, they're working on their mid project reports, I guess is the good way. So Kathy and I should get reports sometime in the next couple of weeks about what they found, what their discussions were, what the processes they'd like to see implemented or changed, or what we're doing right. So so far we're off to a good start. They're touching all of the points that we wanted them to touch.
The only thing that I might have to report there-ish, if there is a question or more detail, She has 171 pages of detail on that report to make it, if someone has a question, more clear when we finally start getting. We may not be seeing the whole detail in our meetings,
But Tish will have it.
but Tish will have it.
I have a couple questions.
Yes, sir.
First of all, I apologize, my camera's not on, but nobody wants to see me laying down, so.
Oh, anyway, we're glad you're here, Ben. You're here.
Yes. So my questions, first of all, I appreciate the fact that the inflows, outflows, and the final number matches, which is good for the June 25. My question relates to the bank account. Is the check register that we're looking at that's provided, that's the operations account, correct?
Correct.
Okay, I noticed it dropped $500,000 from previous month.
Yes,
Okay.
it did.
And I'm guessing you've already answered the question of these financials are not accurate because the end of the month operating account on the financial shows a 200,000 over what's in the
That's
account.
including payroll. That's including payroll and the ACH benefits that don't run through AP. So starting in July, we are booking all of the employee benefits through AP, so we have a better audit trail. It's something I talked about with the auditors, and that's what their recommendation was. Right now, they just print the bill and do an ACH. And so what it does is it skews the rest of our reports, so it looks misleading.
Okay, so that's the difference in the account. Okay. I just wanted, I'm guessing we're not going to close this out, but based on fiscal year, because this is last month of the fiscal year, we had a $2.3 million loss by these financials. Is that going to adjust?
Which financials are you looking at?
So I'm looking at the fiscal year cash flow.
Oh, the cash flow. Yes, that is very preliminary. I have just started going through and making sure our accruals are correct, our revenue is correct. We have a transmission, Epic is having a transmission issue. We have got almost all of them fixed. So those are very preliminary numbers.
Okay, so I would ask the committee and yourself, Tish, if we could leave or be provided this as a standalone document for fiscal year 25 as it continues to adjust. And as we get August numbers, we can just maybe have those added to or additional to, because I want to see where the fiscal year ends up based on the fact that we're showing a $2.3 million loss.
Yeah, it will be one for each fiscal year. I'm not going to carry them off. There'll be a standalone document for each fiscal year.
I appreciate that. That was over my questions.
It starts getting muddy when I start combining fiscal years. So it's easier if we can keep it separate. So I'm glad that meets with that was my next question as to
if we could just keep this updated as part of the discussion until we close it out, that'd be great.
Absolutely.
Thank you.
Thank you. Thank you, Ben. Oops. So, we have a weekly meeting with the auditors of it. I explain that every month. So right at the moment now, they have completed the accounts receivable section, which is the largest section of the audit. And they anticipate that we could be done within 5 to 8 weeks. I put 6 because that was my last conversation, but I had a conversation today with them. So we could be getting our audit done. That's going to be very important for us because what happens is when we book any final corrections for 2024, they roll over and affect 2025 numbers. And so we want to make sure that we have all of those numbers updated and in before we actually formally close fiscal year 2025. Like the accruals roll over from year to year. So we want to make sure that that's done. So we may have to reschedule our 2025 audit from the beginning of September to the end of September.
Because our goal is to still have the cost report and everything done by November, by Thanksgiving.
I think it's possible.
Yep.
Even at the end of September?
To get my numbers done,
And you have, no, for them to be able to get us,
I ask every time. So I will continue to follow up with them. They have a tendency to get a little pokey,
yes.
and it's typically because they do big facilities and small facilities. And so they seem to be very amenable about getting this closed. They want to get it closed so we can get our corrected cost reports filed and everything else. There's a lot riding on it. They also are part of my conversation with the state every month. We have a weekly or a monthly phone call with the auditors, the state, Myers and Stauffer, so we can go over where they're at the audit. So we don't get dinged by the state because we're way behind on our audit. So we just included everybody in phone call. Everybody seems to be happy with that. So we'll go ahead and continue that until the process is completed. Our charge master is, we got our first go through of it. So there's some homework in there that we have to do on our side. There's a bunch of CPT codes and HCPCS that are not current that we will update. So when it's uploaded into Epic, everything will be current, and that we can go ahead and be prepared for our November update through Medicare and the January update through Medicare. So we anticipate that the charge master review will be done at the end of August. They are going to issue us an invoice prior to completion so we can take advantage of our grant. We have to have proof of that by the 15th of August. So we're about 2 weeks over. And we also decided that we will do a 3%, which was what our insurance companies allow, but it's not a flat blanket 3%. We have some charges that haven't been updated for years. And so what that means is charges will go up and charges will go down, and some charges we won't touch at all. Especially, we have a tendency not to touch like mammo costs, because in a rural facility, mammo is really underutilized, and we want to make sure that it's really affordable for all of our community members that need to come in and get that particular study done. Cash collections were down by $300,000, which we have now collected. So they didn't come in June when we anticipated them. They have come in the first 2 weeks of July. So that's disappointing because I always like to have the cash in the right month, but that's just the way it goes. We are continuing to monitor expenses, and poor Kathy has to approve all the expenses. She gets all the expenses through Sage, so she has to go in and approve them. So she's continuing to be very diligent, and the department managers seem to be taking this with stride, and they're thinking outside the box, and they're thinking how we can utilize what we've got rather than go buy new. So that was a bonus, a side bonus we hadn't really counted on. The inventory system is working really well. The primary issue with it is the scanner that they originally bought when they did the implementation for Sage back in January of 2024. So we may end up having to replace that scanner with something that's a little more current. We're still trying to work with it, but that is still on the table. The company ScanForce that has our scanner and monitors our scanner says it's just old. Even though it hasn't been used, it's been sitting there depreciating and deteriorating. It's like a used car, came off the lot.
Tish, if you have to replace that, what's the cost on it?
I'm getting quotes. I don't know. And I know there's the top of the line. So I asked for 3 quotes on what we could get. We'll take it to finance committee when we get to that point, if in fact we have to do that. So they're trying software upgrades and things like that. And those are done at no cost to us. So we're going to see if we can get a free fix rather than having to buy a new scanner. So we're continuing to work with Epic on making sure that all the revenue hits the right departments. So hospital pharmacy revenue was hitting inpatient, swing, and that's the way it was set up during the system. So we just got that project completed, and I'm going to verify that is in fact hitting where it's supposed to hit. So it came out of inpatient swing and should have gone directly into the hospital pharmacy. And we're working with the clinic. The clinic is now, all of the clinic charges show up as pro fees. So there's no facility side there, and there should be some facility side there.
I think that's a novel idea, and I guess I was encouraged just by Senator Driscoll's bill that moves this conversation forward. And let's hear some of those ideas. And instead of just saying, oh, one man, one vote, nothing we can do to help you, Weston County. Finally, it seems like the issue has been forced a little bit, and I'm encouraged by that, at least.
I'm very encouraged by that, and I'm encouraged by the fact that the commissioners haven't pulled that resolution that created the constitutional senator and representative for Weston County. I think that them not backtracking helps a lot and solidifies that it's not just this handful of people that want Weston County to be represented. And I think that the conversation is going to be really good, and I think there's going to be a lot of ideas thrown around.
So we're working with Lene next week to see if maybe they bundled everything, although I'm not quite sure how they would do that. She says, I kind of remember, she's got some notes, she's going to dig them out, so we'll be able to get some more information by next finance committee as to what we're going to do. And we may need to reevaluate those particular charges altogether as part of the charge master review. So, and then we have the pretty, it's not pretty. This is, it's not sorry, colorful. Let's put it that way. So we're seeing that our accounts receivable days have gone up. And while statistics went up, it wasn't really enough to warrant that much of an increase. So we're taking a look at that, seeing what the root cause is, and if we need to reevaluate processes. Sorry. No, it's okay. I just didn't want the lid to fall off in your lap. So it is not pretty. They went up from prior months. So we've got breakdowns by financial current. So we've got the professional billing piece is at a standstill. So one of the reasons that is at a standstill is we had an enrollment and credentialing issue with one of the providers, so they held all the claims. So that's being rectified. That enrollment was completed and is active as of March. I don't know if it's March 1st or March 31st, so I apologize for that. But we'll be able to submit the claims that we can do, which will lower our accounts receivable days in the clinic. Upton especially, because they're all for Upton. So we were afraid, we found out, we thought originally that Meridian had done something to combine our NPIs, which is what we bill for, how we bill, it's our identifier, along with our PTANs, which is a Medicare number. But that's not exactly what happened. We were holding claims, and then all of a sudden, Novitas decided that our registration for electronic billing had gone invalid. So those corrections are in process, and we started those corrections on Monday. So I hope, I'll let everybody know, but my hope is that problem is rectified within the next few weeks, and we can drop all those claims to the correct payer, so we can get our days to drop down. So I know, is there any questions, or do you have any concerns about our accounts receivable? Share. Okay, I did bring the check register for everybody to take a look at it, so that check register. You can go through and look at all the, reports. Keep going. I think I'll put little folder things in there. This is our AP check register. So, these are all the checks we wrote over the course of the month, and as Ben brought up, it is down from prior months. I will tell you that July we made up for it. We've cut a bunch of the AP checks when the shortage of cash, our shortfall, our 300,000 came in, paid all vendors. So, we'll show more cash out dispersed in July than we did in June.
Those asterisk for our employees, that's mileage and things like that.
Full reimbursements, but it's not additional pay. We are now also, we went back in, and anything that has a PR in front of it is a patient refund and will be removed from the list. We'll just put a bottom log on there that patient refunds in the amount of X amount of dollars. And that could also include insurance. So when we say patient, it could also insure Blue Cross, whoever we happen to have gotten overpaid by. And then we have, and do we need to go over the cash sheet?
Question real quick.
Absolutely.
What is Albridge? There's a check for $1,015.
And it's a monthly maintenance.
Okay. And the Amazon Capital Service?
That is, we have a business Amazon account because a lot of times we can find our supplies at a cheaper rate. So we do have those through Amazon. Thanks. You're welcome.
Just don't ask what Banco companies is, because I haven't figured that one out yet, so I gotta look it up.
I have the note. I have it sitting on my desk. I did look it up.
I don't know what it is. I always like Bimbo Bakeries. That sounds so.
That's a happy name. Yeah, it's a happy name.
There's a lot of people to pay in a hospital.
We have a lot of vendors that we utilize on a monthly basis, and then some of them we just do quarterly, but it's very exciting, making sure, we probably get 300 emails a month. That's how our invoices come, via email. So we have electronic record. So on the cash flow sheet, I did want to bring up that we made some slight changes in the descriptions. If you look under inflows, it says increase, decrease. So what we did was we put the descriptor of its last month versus current month, and that's how we get that number. So it would be like right about there. So we did that all the way going down so that so you would know how the formulas work. So if there's any question.
Well, that's like that example of 1.8 million that's down in inflows on May, and then June's inflow number, that the difference between the two of them is that 34.
This is 34,000. Yeah. So we thought maybe that would be a little help, and it helps with Emma on so she can double check her formulas on the spreadsheet. So we thought that was a good thing, but that's the only change we really made to the formatting. We did also put on there is a little note at the very bottom that says funds transferred to operating and the reasons for it. So when we transfer funds out of the money market account, we wanted to be able to have it at a glance to where you would know what we did it for. So the $186,000 that we took out in April was for the lab equipment. The $42,659 was for the RADX, which is part of the CT project. In May, we did the filter, and that was the $17,750. So it lets you know what we're spending that money that we're taking it out for, because that's where we put it in the
That was
first
the
place.
injector, right? Not the filter. Injector.
It is the injector.
Yeah.
That's right. I put filter just with this.
Okay.
Yeah.
So just to be clear, that's not us taking money out of savings, it's money that we specifically put in a bucket.
It's our donation.
For those particular
Okay,
expenses.
so this April 24, is that the 24th of April, or is that April 2024?
It was
April 2024.
2024, okay.
So, and that's, we put all that, so we put the donations in there. So this is a discussion piece. So do we want to put in there that we put a donation of $500 in the money market account? This is when we're drawing it out so you can see. How much detail do we need to know? Yeah.
I just wanted to know if it was 2024 or if it was the 24th of April.
Yeah, it was 2024.
Yeah. So, and that's,
What we want to know is we want.
No, it wasn't April 2024.
it wasn't, it was
It was not on this.
Yeah, it's 2025.
It says 2024.
This is April 24th. I bet
It's 25.
25.
Oh, I see, I'm sorry, I was looking way up here.
And I was like, I said, oh, that can't be because I wasn't here yet, and we got it while I was here.
Yeah, good job, Mary.
Thank you very much. So what is it that is there anything that we should be putting on here that we're not putting? Is there something on here that is not relevant or not important? You want to just, we've revented this form 4 times. So if we decide a few months into the fiscal year, the new fiscal year, that it doesn't work or you want to see some changes, it's relatively easy to go through and change.
So I think that's, we can talk about those kinds of things in finance committee. Yeah, and then that way you guys can make recommendations, what you want to do.
Okay.
Okay, good.
I'm glad. So then we have the statistics. Does everybody have the statistic report?
So,
Yep, we're back at Cap.
I'm still back. So the 2.3 million that was transferred, all total, that was transferred to, okay, so that started, that was, the big chunk was in July of 24 and in August of 24.
Correct. Out of the money market account.
Right, and that doesn't have anything, like, because clearly those reasons aren't that much.
No, it doesn't have anything to do with the regions. It was transferred for operational purposes, and that's the only.
It was not done the way it was supposed to be done, so it was, something that was a habit before I got here, which was they were floating money back and forth, which is not what is supposed to happen. So it's not happening now. It has to have board approval. The only thing we do is if we put money in there, like the money market for donations or things that we got for specific, then it's a way to hold that money over.
Right.
And
That's what these little things.
right. And the assumption is that you all know we put it in the money market and pull it from the money market when we have to pay for it.
Another big chunk that goes in there and comes out regularly is like the cost report adjustments that are once or twice a year. Those sometimes go in there to be held and then they end up being paid back or something.
We know we're gonna pay it back.
I just read the policy on the CDs. That's just whenever we feel like we're flush with money, we'll put some more CDs in. So let's hope that comes up in the next couple of years. Yeah. Yeah.
I would like to get flush with money. So any suggestions you have, be sure to just, you can let Kathy know or Carrie know, and we can make sure that that happens. And then we have our statistics. So you have your statistics? I've got several pages. Several pages. Thank you.
Just keep reminding.
You have things to do with help us to do it.
Yes, very helpful. So it shows that we had an increase in patient days from the prior month we went to 33, compared to 24 from May.
It's busier in July now, thank
Yeah, it's
you.
busier in July. May was a slow month. However, the exception to that is swing beds went down.
But it's coming back up now.
But yeah, then we have swing beds now,
Mhm.
right? We have
Yep.
swing bed
Yeah,
patients
it was a really slow June.
for swing beds, yeah.
Mhm.
So, we have hospital discharges, which were required to mandate. We have outpatient discharges, which is observation, any kind of outpatient nursing service, which we didn't have any. ED visits were up slightly over the prior month. So, and then we have, Newcastle went up by 1 visit for the clinic, and it went up considerably for the urgent care visits or the walk-in clinic visits. So, I'm not quite exactly sure why. Lene was going to do a little bit of analysis on that, see what they were coming in for, to see if it was just more drop-ins type of a thing, people visiting or things like that, rather than
Someday we'll work on that, because sometimes people use the urgent care instead of doing a continuity with one provider, and they just come in when they're really sick and they don't care to be, do primary care stuff. But someday, hopefully, we can get people to feel like they want to do primary care too. Yeah.
You'll start to feel connected.
Right. So that's something Lene's working on, and she's been working on that for a couple of months. So we're hoping that she's able to see a forecast in the trend, so that will help. Optum patient visits went way up, which was good. From the prior month, it was bad. So we've got lab procedures. Lab procedures went down. Erin couldn't explain why, when we had more inpatients, as to what.
I think it's because of the days in the hospitals. While they're up from May, they're still down
in general.
So that's what I think it is.
Yeah. So she was able to give me a bunch of information for our charge master review. So radiology went up across the board, which was nice. And of course, Keisha is continuing to work on the CT project, which is very near and dear to her heart. Physical therapy went down. Occupational therapy went down. Speech therapy went down, but maintenance went up.
Right, you think I got that $10 deal back in?
Oh yeah. Oh yeah. That was quite the change. That was quite the change. So people seem to be evening out about it.
Some people wondered. Yeah. And then they started saying, well, can I pay for 4 times or something at one time? And it's like, yeah, we're talking about is if they continue to complain, usually it's when it's first new. If they continue to complain, then maybe we'll look at a process where they have a card and they have so many months on it. We punch the card every month or something and make it not so. So we even talked about a senior discount or something. But it's really
Off of $10.
Yeah, I know. But it's $10 per time, and there are some that come $50 a week, so, and so, hey, we're just trying to make maintenance is important for us to make sure that people are.
You want people happy, and you want it simple.
Yeah.
Yeah, we want them to come in, so we want to make sure that it's easy for them to come in.
Yeah, but it's simple.
Forgot my lunch card.
Not your lunch card? I'm sorry.
Well, you can't, so can you cut two next time on break?
So, yeah, that will be something that we'll have to keep track of, so.
Head
therapies. Yep.
Are they still doing cardiac rehab? They are, but what was happening is that they, somehow it's not being captured on the revenue side of it, and we are trying to figure that out with Epic, but they are still doing it. Mm-hmm.
That's one of my little projects, to make sure that the revenue is coming over. It may be coming over, we just don't know where it's coming over to.
Right.
So, well, we're working on that. So, let me see, therapies, scheduling home health visits went down. Skilled nursing went down, the aid and the physical therapy, but occupational therapy went up. And at-home services is down. And then we have the Manor. You can speak to the Manor.
I think in-home services went up this month though.
Oh, in July.
In July.
Part of it is because we had staff now to cover it, so it went down a little, and I like that because it's CNAs versus nurses giving baths to patients that are in our subsidized program. That isn't a good.
I saw Carmen at the farmer's market and she was in scrubs and I said, how's retirement? And she goes, you're not that good, huh?
She's filling in for Heather. She's very kindly stepping in, so that's very good. Very nice of her.
Glad to have her.
Absolutely. Do you have anything to add about the Manor that you haven't already done?
I'm so excited about the Manor. Oh, look at that trajectory. Just keeps going.
We're excited.
They're awesome.
It does, and he has to keep working at it because his patients go to heaven part of the time, so.
Lester discharges are so sad. Is there anybody that has any questions about the statistics or any of the reports? I know I went kind of through quickly. So if you come up with a question at 2:00 in the morning, please feel free to email. You don't want to do my best thinking.
Do I have your phone number?
Absolutely. Here.
Thank you, Tish. Yeah, thank
Thank
you very much. Hey, on to Kathy.
Okay, I wasn't really sure by the time we were doing the agenda what I was gonna be talking about, so now I have a list over here. It was like, okay, what do I need to talk about? I just wanna mention that we had the water softeners have problems. We put valves in them, which cost quite a bit of money, but I think it was like $5,000 just for 2 valves. And then they turned around and they still weren't working correctly, so we had to replace them. I called in because it was an emergency for the water, because water was being wasted basically and going in straight into the drain. So we have got water softener tanks. They're not quite here yet, but they should be here any day to be able to stop that problem. In the meantime, we're wasting water, but we don't know what to do. But the only thing I would bring up is, like, normally it was like there are some things that are emergency, and I just want to make sure that when we go through the bylaws that we talk about that, because kind of it says, we'll get the whole board together, but there's times where you may have an emergency where you just have to do things, and I want to feel comfortable that I can take care of an emergency, but I also want to make sure that I meet your needs regarding timeliness of response to you guys on it. We had some errors happen from an employee's mistakes or something that they made, but basically we have a doctor, this was mentioned a little bit, Dr. Blanchard and Dr. Akers, that had some problems with not being recognized by Medicare as being in. So we may have some write-offs to the tune of about 32,000 or something like that.
About that.
For theirs from January 1st until the end of February, maybe possible the end of March for Dr. Akers. That will be addressed because it's an error that shouldn't have happened, but I wanted to let you know about it.
Does that seem like something that will not happen probably once you have
The system written down, and hopefully yes.
Well, I was thinking more of will the clinic manager help with that?
Oh yeah, that'll help because she can do enrollment too. I was going to talk about her today too. So, yes, that will help a lot. But this was not, in my opinion, an acceptable mistake. It cost us too much money.
So how?
I can't say too much because I'm saying enough, but I wanted you guys to know about that. Because I have to protect people. So, just so you know, for the month of July so far, we have 10 of those echoes done. So that's a pretty good increase from what we had even last month. And, you know, we have a very excited person working real closely to get those things done, Keisha. So, and she said, you know, we've made a huge gain, which we have, because we were getting like 2 a month, 1 or 2 a month from 3 to 4 months ago. Rough numbers say that we're going to at least gross maybe $80,000 a year from the Echo project change. And we're going to still investigate that because we do have to do some CPT changes that we weren't getting paid for some of our echoes because we didn't have the right CPT coding for them. So now we're changing our coding for not only plain echoes, but the ones that we do with that added medication that helps look at calcium and all that sort of piece of it. And so there will be a revenue increase also for the pharmacy out of that because of the medication. So I just want to give you preliminary. This is a rough number, but at least it tells us that it's a nice gain. And it's part of trying to gain 0.5% of revenue towards our new budget. And then the new MRI, I didn't make copies of this for you because truthfully, I don't think you'd want to have it hang around your house, but it's like, they've got this down to a Keisha's liking, and it was hard for her to get people to help her want that, but she's by gosh batted herself a little map. So we're looking at a go no go inspection with the state on 9/16, we hope, for the project with CT. And then the physicist inspection is sometime in August, and the state sign off we're hoping is in August. The naysayers say the state might take longer, and there are pro-sayers that say they're doing really good and it should get done pretty fast. So I don't know the answer, but it's on here as to be determined. And then they're going to deliver and install the new system on 9/23. We did push the project back 2 weeks just because of stuff you guys don't even need to worry about. And they were hoping that the applications and stuff will be installed by 10/13. So there's a little bit of a delay in the times, but it's definitely doing better. We did find out already that our flooring is fine. That was something that somebody was worried about. Our electrical is fine. Of course, we have lead walls, but we had to convince somebody that we could do that. I apologize. That's telling me to take meds. The power injector isn't gonna, somebody was worried it would be a big project, and it's not going to be. It's just a small project to be able to get it up into the ceiling like we need it to be able to. So the deinstall of the Siemens is projected at August 19th, which means we would go to the one outside, or mobile unit. Mm-hmm. So if you want to look at that, you're welcome to, but I didn't is you up with extra papers. Then let's see. I just wanted to thank our team because we did do an RCA. I asked them if they would do that on those missing keys. They did a good job of working through the RCA to try to get to solutions because
what is RCA?
Root cause analysis. And so that's the specialty for Miss Kim over there to help work with your teams.
I was going to ask too.
I knew what, well.
A root cause analysis. Anytime you have certain situations like narcotic keys and med keys and stuff like that go missing and no one can find them, that's a big deal. So we wanted to make sure that we changed our processes and stuff, made sure that we're doing okay. We even looked for some diversional activity pieces to see if we saw any diversion lookalikes. And we've done some testing of employees too. So just so you know.
Or did it look like there was?
Well, the one challenge we have is that there's one person that I can't say who, but that is positive on a test, but they also have prescriptions for some of that stuff, which we of course didn't know about because they're a traveler. So we're gonna have to have an MRI done, and the problem I see with that potentially is, would they have taken anything that they take at home normally, and we wouldn't be able to tell the difference in the first place. So, but we're going to make it a lot harder to mess up, so that people don't have that exposure, don't want them to be exposed to that. And that's what I can say about it. But I really am appreciative that they took it seriously, because it really needs to be seriously looked at.
Well, it's a protection for our employees too, so they're not accused of.
That's exactly right.
You know, it's not all punitive. It's a protection for them.
Absolutely, yeah. We did have one employee that was a newer employee that was a random test positive for marijuana, just so you guys know. And they had an attitude of, yeah, I don't know if I can give it up. And yeah, I talked about their license and everything to them, but basically I said, this isn't probably going to be a good fit, because professional licenses require you to not use that. So, and she wasn't sure. And I appreciate and applaud her for giving the truth out once we caught it. That's very nice. But that person has been removed from our staff, so that you know. And I'm going to actually just have to say that I'm glad we do randoms on the professionals, because we've caught people, even not on the professionals, that have had problems. In our vehicle policy, which I just read again recently, which now you have, it does talk about the fact that even if you're not at work, if you get a DUI or a DWI, and that you have to report it to work, so that we have a way to be able to monitor, and like people that we feel like are redeemable and that they'll do some things to get that taken care of, then we've been working with them and they've been successful. But this person.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
Didn't sound successful on that end of it, and so I was really shocked, because we'll have to turn her into her nursing boards, and she has 2 of them, 2 state boards. So we had a meeting with EMS today, and we talked to them about sick patient transfers. We did have a transfer the last couple of days. The person was very very sick. They had sepsis, and they had gangrene in their intestine area. And we had one other case that if surgeon was barking down our backsides because they didn't have the patient in for surgery yet for a different case, and we couldn't get ambulance. And then there were days where the weather was such that we couldn't get air flight either. So we had to talk with them to investigate it, because the reason they gave us for the person that had sepsis and gangrene, the reason they gave us for them not being able to do it was that they were at shift change, and that they weren't going to take the patient. So we don't find that an acceptable reason at all. So we're really having trouble with that, and it's pretty scary sometimes, because it's not, to the very least, it's very dangerous for that patient. But the other part of it is it puts us in a liability situation, because we have somebody that's only going to get better with surgery that we don't provide. So it's very concerning. And we did have our trauma meeting this month, and there was one case that we talked about that the one improvement we would have made is giving some blood to a patient that had pretty good blood loss. So that'll get back to the provider to talk about. But otherwise, we had real good results from our traumas.
Kathy, you had talked at one point about a air ambulance company that that you had a special arrangement with. Was that not an option on this one because of you couldn't get air?
We couldn't get air out. It wasn't an option. So that's the failure of the plan, because if the weather's bad like that, now the ambulances can still go when that weather's bad, but certain conditions in the air they can't go with. So that's part of the problem that was there as well.
Thunderstorms around that time that they couldn't launch. So
Yeah. Just so you know, I have the senior leadership team and myself working on attendance and tardiness policy, and then we'll take it back to HR. And really, it's just because it's a very complicated policy to read and understand, and then try to make sure that you're consistent with your staff on it. So that this is something I just wanted you guys to know about.
And that is something I consistently hear, even still, is people feeling like some people are favorites.
Yeah, it would be real easy for that to be the case, because this policy is convoluted, and quite frankly, I think that there's also some independent interpretations from staff on how they interpret applying it with their staff, the managers with their staff. So that's part of the reason I'm bringing the senior leadership team in, which is the directors and above, because we're going to try to make sure that we can simplify it and then bring it to the managers and get buy-in on changing the policy, but then have consistency in the policy. Because I spent way too much time correcting people's early outs, early ins, late outs and ins and all that kind of thing. And especially shift workers, they need to be timely because they have somebody that's dependent on them to be at work on time, and that sort of thing. So we're working on that part. And then we discovered that we don't have a clearing account for the Manor, so we are going to be fixing that so that we have a clearing account. That created a little bit of problems for the VA payments, correct? Is that right?
And it's a general ledger number, not a bank account.
Yeah.
It's just a accounting account number.
Yeah, but clearing account.
Clearing account, yep.
And I think the only thing else I was going to mention is August. I said August 6th, but I got a note back from HR that it's August 4th because that's the Monday. Trissa Linford is the person that I hired for the clinic as a clinic director. I changed it from manager to director because it matched our other director level people. And with her education and training, it really made better sense. And so I've mentioned her to you before. I'll pass this around if you want, but she's had experience in what they call operational revenue cycle architect, which is basically building and getting the things put in place for companies so that they have their revenue cycles working the way they're supposed to. She's been a revenue manager. She's done credentialing as a coordinator. And she's worked in a surgical coordinator, office manager for a clinic in Sandy, Utah. She's done collections and legal assistant work. So she's kind of got a nice rounded education. She went to KU, which a lot of people around here like. So she's certified in compliance as a compliance officer. And so I think she'll make a pretty good fit. She's not a nurse, and I'm okay with that. She's got the help. She's got the manager experience and I put her through the paces because I called she had references, but I called additional references, and she really had to wait for a while because I was trying to sift through all the different applications. I've got a couple since her, but I'm very comfortable. She's a good fit for the clinic. And so when she gets in, I told her that maybe the next board meeting she could come and you guys could meet her. Okay?
What date did you say?
August 4th is when she starts.
And you said her first name was what?
Trish. There's Tish and Trish.
And it's Linford. Okay, thank you.
Her husband's a veterinary, and they live in Sundance, and they live on a ranch, but I don't know anything about where yet anyway, so I probably wouldn't know even if she told me because
Her husband is a vet?
area. Huh?
Her husband is a vet?
Did they just recently move?
He's a large animal vet. Yeah, I think they did. They've only been in Sundance for, I don't remember how long, but a couple of years.
I wonder if that
Must be Warren's son-in-law. That's.
They seem, she's really a nice lady.
Well, on life.
And then I think that was everything I wanted to bring up to you. I have some stuff for executive session, but not anything else for this week part.
Yes.
Yeah, question for Kathy, you talked about water softener replacement, did you have a comment on that?
Oh, yes, 24,000. There were 12,000 a piece. 12,000 some change. And I'm very sorry because I didn't want to spend it either, but I've told Ron that this last couple of months he's been a little spendy for me, but he's taking care of the building, so I can't say much about that on the main. Yeah, exactly. I was teasing him, but he's only asked for things he really needed, so yeah. He has that famous job of having the most expensive things to deal with in the building. So.
Do we have, so you were gonna talk about the foundation too.
Oh, the foundation. The foundation, let's see, they didn't have a quorum. Then this last meeting that they had, they basically just went over the party for the kids' daddy-daughter dance. And we got some money given to us for the Manor that was like $6,700 for the Manor to be able, from a family, and Mark was part of that family, for them to do some work on dealing with dementia patients and their agitation and that sort of thing and how you work with that. So there's going to be some courses, and I don't know which one you decided, but it looked like you're going to train people to be trainers as well. So there'll be certification to train people to be trainers on how to manage patients with dementia.
Awesome.
Yeah, so we felt like that was a big need. I think that's it for the foundation. They're meeting next week on the 24th, so I don't have any super news, so.
Did Corrine stay on the foundation board?
I haven't asked her about that. I'm gonna ask her if she wants to stay on as a she's this month she's not super communicative, so I don't know whether she'll stay on for yet or not. I hope she does because she does a really good job on it, and she likes it. She's done some good fundraising, so we'll see. She really seems to enjoy it.
That she does.
Yeah, she's very good at that.
That's all.
Anything else we need to talk about before we go into executive session? So do we want to take a few minutes break before we go into executive session?
Dinner? Yeah, but your dinner?
We're just dinner and a break.
Yeah, and a break. Okay, so let's be back here in between 10 till and 5 till. We should be all ready to go 10 till. So, how are you doing up in there, Ben? Back in your computer land?
I'm doing fine. Thank you.
Okay.
Can we bring you a sandwich?
I'm already eating dinner. Thank you.
Okay, we'll see you in 5 minutes.
We'll eat your share of dessert, Ben. You can't see yet.
Okay, sounds good.
This place is full of love. You can tell the people that like to be with old people because they really take care of you good and are very kind.
Twice a day, every day, activities people have an organized activity that's always interesting.
Everybody loves to play bingo. We play it 3 times a week here. We also have ceramics that you can paint. Really pleasant to live here. It's a good place to be.
while we're eating?
Yeah, you can do that. I'll just call it and then I'll go put the doors up.
Okay, so. We get how to call it the executive session. Or we
Make a motion, Jeff.
someone want to make a motion to call us into executive session? Or you gotta leave it open?
Yeah, until you're done.
Oh, you're not.
Well, Madam Chair, I make a motion to go into executive session under Wyoming statute 16-405A on matters concerning proposed litigation to which the governing body may be a party, and IX to consider or receive any information classified as confidential by law, including attorney-client privilege communications, quality information, and trade secrets.
Okay, we need a second.
I second it.
Okay, all those in favor say aye. 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 All those opposed, same.
Yeah.
Oh, we need to admit Ben.
Did you put him in a room? No, Allison.
Why is Allison on my place?
I think you gotta put him into a, not go after we go out.
I'm just switching devices.
Okay. Hear Mr. Roberts say aye or nay, either one.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
Yeah. Hey. Oh, I did that. That's awesome. Okay.
Okay, I would entertain a motion to.
First one,
I did have one thing on my notes I forgot to ask Kathy. Kathy, with the new clinic person, can we make sure that we keep on the list that we're going to look into the VA certification?
yes, absolutely. We will do that and get it resolved. I know they've been working on it, but she's got some good skill sets, so I'm looking forward to it. Thanks.
Okay, thank you.
Mm-hmm.
That's all I had.
But
And you just need to say you didn't have any motions.
Okay, we did not have any motions in executive session or take any action. Does anybody want to adjourn the meeting or entertain a motion to adjourn?
Madam Chair, I make a motion that we stay for 3 more hours.
Okay, we make a motion that we adjourn.
we're gonna get a second.
I second that.
Thank you, Ben. All those in favor say aye.
Aye.
All those opposed, same. We are adjourned.
See y'all.
Thank you all.
Thank you,
Thanks,
Allison.
Allison. Bye, Ben.
I can just close this stuff up and then it will do that.